Good afternoon and welcome to the Columbus Metropolitan Club. My name's Jane Scott, and it is a pleasure to welcome you today. I'm President and CEO of the Metropolitan Club, and we are live streaming our forum from the Boathouse at the Confluence Park, as well as welcoming an audience here in-house. So thank you so much for joining us. We're live streamed today thanks to our live streaming partners, the Columbus Dispatch and PNC. We'd also like to thank those of you who are watching today who purchased a virtual seat. We're very grateful for this support, and you are making it possible for us to continue our live streaming services. Thank you very, very much. Today's forum is part of our Optimal Health series, presented by CMC and the OSU Wexner Medical Center and Nationwide Children's Hospital. Won't you please help me thank them? Unfortunately, domestic violence was an epidemic before COVID-19, but the health crisis has caused a tremendous spike in incidents of abuse. And experts are also gravely concerned about abuse that is not being reported. This is a critical time for survivors. Greater awareness, better education, and bystander intervention are desperately needed. Please help me welcome our speakers to discuss this important topic. President for the Center for Family Safety and Healing, Lynn Rosenthal. Thank you, Lynn.
Thank you.
The Director of Franklin County Job and Family Services, Joy Bivens. Joy, thank you. Brandi, a domestic violence survivor and an ambassador for the Center of Family and Safety Healing. Brandi, thank you so much for being here. And our host for the Optimal Health series, Interim Director of Professional Development at the John Glenn College of Public Affairs, The Ohio State University, Greg Moody. Greg, the show's yours.
Well, thank you, Jane. As COVID cases surged in the United States in March, stay-at-home orders were put in place. With personal movement limited and people confined to their homes, there was growing concern about a potential increase in intimate partner violence. Stay-at-home orders intended to protect the public left many victims trapped with their abusers. Domestic violence hotlines initially saw a drop in calls, then the number of domestic violence cases increased. Another important truth also emerged. Inequities related to social determinants of health are magnified during a crisis, and sheltering in place does not inflict equivalent hardship on all people, including as it relates to violence in the home. As we move through COVID and look for a new normal after COVID, what can we do to ensure that people who experience abuse can continue to obtain access to support, refuge, and medical care? I'm so glad to be joined by this panel to wrestle with some of those questions. Please reintroduce yourself. Say a little bit about the role you play, and what is it that drives your personal commitment to this topic? Lynn?
Well, I'm Lynn Rosenthal, and I'm the president of the Center for Family Safety and Healing at Nationwide Children's Hospital. Thank you for having me and for having this important conversation take place. We address family violence across the lifespan, so we provide services for children who've been sexually abused, victims of domestic violence, at-risk moms and their babies, and children in foster care. And what really ties all that together is a commitment to the well-being of children and families. I have to say a word about our local partners who really form the backbone of the response to domestic violence in Franklin County, and that's Choices as part of Lutheran Social Services. They're the local domestic violence shelter. The City Attorney's Office, that's Zach Klein's team of lawyers and victim advocates who are frontline and helping victims get what they need. And Sergeant Rich Ketchum, who is the head of the domestic violence unit at Columbus Police Department. So these folks are working night and day to protect victims of domestic violence, and I want to make sure we kind of talk about them here today. I've been in this work for about 27 years. I started at the local shelter level and went on to work in state and federal policy. I was the head of the National Network to End Domestic Violence in Washington, D.C., and in 2009, I was appointed by President Obama and Vice President Biden to serve as the White House advisor on violence against women. So I was in the White House for 5 years, but it's really sort of dog years because each year is so grueling that I feel like I was there 20 years. But what's so exciting for me about being here in Columbus is that we're working on the same issues that I was looking at in the White House. How do we reduce domestic violence homicides, especially at this critical time? What is it that employers need to know to address domestic violence in the workplace? And then what are we doing to help young women? You know, young women ages 16 to 24 face among the highest rates of dating violence and sexual assault. So these are critical policy issues. It's personal to me because when I was 19 years old, I was one of those young women. When I was a college student, I was in an abusive relationship. I didn't have any language for it. I wouldn't have called it that. I didn't really know quite what was happening to me, but I was isolated from my family and friends. I dropped out of college. It was blessedly short. I found a way to get out, and I had 2 friends who didn't judge me and helped me with that. But it kind of derailed me for my early 20s, like just starting out in life, that period, that critical period of time. And it was only when I started doing this work that I understood the long-term effects that had on me. So I'm passionate about raising awareness about the pervasiveness of domestic violence and its effect not only on victims, but on families and communities. This is not just a law enforcement problem. It's a public health problem. It's a health and mental health problem. It's an economic problem. And as you said, it's a problem of disparities in our society. So I believe, I'm optimistic that we can end it, and this kind of conversation is a place to start.
Hi, I'm Brandi, and I am the ambassador for the domestic violence part of the Center for Family Safety and Healing. My goal here today is to help everyone that do not know the resources that are out there for everyone to receive if you are in a situation, or if you know someone that is in a situation, or if you have children that are in this situation, that they can either not get out of, choose to not get out of, or do not know what is out there for you after you are out of the situation. So it's my pleasure to be here today, and thank you for having me.
Good afternoon, everyone. I am Joy Bivens. I am the Director of Franklin County Department of Job and Family Services. As many of you know, our organization provides core support services in public assistance benefits. So that includes Medicaid, food assistance, which used to be called food stamps, child care, workforce development, TANF opportunities. We also put about $30 to $40 million of contracts on the street to organizations in the scope of after-school programs, workforce programs, summer youth programs, just an array of services. Why am I here today, and why is this important? One of the things that my position is appointed by the Franklin County Commissioners. Many of you may know that. But when we look at the most vulnerable, people look at my position as I'm just only supposed to be concerned about poverty. And I am. However, it goes on a bigger scope than that, because if my position is to look out for the most vulnerable, domestic violence victims are vulnerable. So the decisions that we make at Job and Family Services in funding, in providing resources, we have to make sure those resources get to the most vulnerable, particularly domestic violence victims, in a way that they have access to them and not create barriers for them to feel safe. So that is why I'm here today. So thank you.
That's great. Well, thank you. And, you know, you each represent a tremendous capacity and resources to bring to bear, but to work up to that conversation, what is the scope? How has COVID changed things? Here in Central Ohio, what is the nature of the problem? Can you say a little bit about the scope of this issue here in Central Ohio?
Well, we all woke up to the news this morning that the Ohio Domestic Violence Network reported that domestic violence homicides in Ohio had increased by 35%. I think the COVID piece of this is complicated. So what we found in the beginning of the pandemic is that the numbers of new domestic violence survivors reaching out for help, people we hadn't seen before, dropped down by about 44% over the previous period. And we can all imagine why that is, because of people staying at home, having trouble reaching out for help, and worrying about all the things that we were all worried about, our kids at school and how the community, what we were doing in the community, what was happening with our jobs. And so we saw a decline in people reaching out for help, but now that's gone back up and it's actually above our numbers from the previous year. There were, numbers are hard in this area, but there were 12 to 16 domestic violence homicides in Franklin County last year. This year, as we said, we've seen those really bump up. So our numbers here are the same as they are around the country. 1 in 3 women will experience some form of abuse at some point in their lifetime.
And Joy, that's what you've been seeing through the county?
So particularly regarding domestic, so we look at the data. So Lynn, of course, is much more versed in this because she knows a lot of the data. But when we look at some of the data that we've seen domestic violence phone calls for law enforcement have increased. So when that happens, we are assuming as system leaders, we're making good decisions by allowing people to work from home. But we don't look at it from the perspective of that we're creating an environment for our employees to be unsafe. So then we have to, as a system leader myself, I have over 600 employees. When we hear these numbers that Lynn referred to, it's not, as a system leader, as an employer, I can't then say, oh, domestic violence is up, those poor people. I have to assume that some of those people are my people. So I have to make a decision on what am I going to do to ensure that we provide flexible opportunities for domestic violence victims to be safe. So what we did was we allowed employees to come back into the buildings. If you don't want to work from home, that's fine. It's an option for you. But please know you have an opportunity to come here if that is the option that you choose. Now, we were not invasive to walk around and say, hey, are you being abused or something that we can do, because we understand there is fear in those regards. But we have to make flexible decisions, and when we hear this type of data and you are able to make a system leader's decision, don't assume it's them. Assume it's the people that are working with you, alongside of you, and under you.
And I think that's such a critical point for our audience, many of whom are employers and business leaders in the community, and the role they can play. And Brandi, as an ambassador, I'm sure you encounter folks who are trying to just identify themselves who to reach out to. So kind of shining a light for folks to approach in the work you do.
To shine a light on that, as Lynn and Joy both spoke of, first, the statistics are, I've never been one to follow statistics, so to hear that and to know that number and to know that I was once a part of that number, it's like you feel as though you're the only one in that situation. You feel as though no one will ever understand, or no one will ever listen to me if I say anything. So having the numbers and the resources to call, sometimes, in speaking to what Joy was saying, sometimes having those avenues available for you, it's feeling safe enough to pick up the phone and to say, well, I wonder is my phone tapped? I wonder, does he have access to whoever I'm calling? I wonder if she feels as though it's okay for me to do this, and if I do get out, can he or she find me? So I can call, and I can call, and I can have access to those resources. But when I do receive them, am I safe enough there?
Well, let's stay on that idea a little bit, because, I mean, with the prevalence and the scope such that we all probably are in relationship with people who could use assistance, or individuals ourselves seeking assistance, at an individual level, what do you do? If you're the individual yourself who needs assistance, or if you're a family member or a work colleague or somebody who wants to help, this can feel pretty overwhelming. What is your advice at an individual level to be able to take action? And I'd be curious to hear from all three of you.
To be able to take action, first off, we need to often, when we pick up the phone, those who are taking our information, or those who are a part of getting us to the other side of getting us out, don't always look at us as a statistic. don't always judge us for what we're calling for. You have people that deal with this all day long, and then you have people on the other end, and when they hang up from my call, then it's immediately like, oh, there's another one, they deserved it, or they this, or they that. So for a person that's in it, you have to, I would say, if you had to pick a starting point, start with getting out of your own head. Getting out of your own head, and it's hard to do when you're in a situation, but you have to start somewhere. You're calling for a reason, and if you yourself do not feel that you are valuable enough to get the help for yourself, then for me it was my children. For someone else it may be, it could be a number of things, but find a starting point. That's where I tell people, is just find a starting point. And if you don't have a starting point, just picking up the phone and saying, you know what, I've had enough. And then it starts there.
And if I can just jump in just really quick, thank you for sharing that. And again, I'm not a victim of domestic violence, and I don't know what that is, right? But as a leader, again, I have an obligation to make sure that resources are available to domestic violence victims, and that means in any capacity. If you're calling Job and Family Services and we're putting you on hold, then during that whole time, maybe there's a recording that I put on that line letting victims know what resources are available to them. Many people may not know, several years ago, in order to receive emergency cash assistance in the terms of housing, you had to be late 5 days on your rent, right? And you have to show a lease and go through all these things, right? 3 years ago, when 3 or 4, I don't know how long I've been there. Don't tell the commissioners that. I know I'm on camera. I'm trying not to get fired today. So whenever I came in, we did a collective community conversation. Why do we make things so burdensome and over-assess people when they're in crisis? We have to eliminate the barrier for people so they do feel safe, so that, I'm asking you a trillion questions just to ensure you're saying what you're saying. I'm looking at you, saying you're in crisis. Push a button, make something happen, right? So what we did was we eliminated the barrier of waiting 30 days, because if you're a domestic violence victim, you don't have 30 days. And we understand, and you didn't have to show us the lease. So if you're couch surfing, if you're staying on someone's couch, let that person write us a letter. Say, Joy is staying on my couch, this is what's going on, and we accept that, and we will give that domestic violence victim or anyone in that situation $1,500 in assistance in order to get them to their safe point, whatever that housing. I mean, there's criteria, of course, under TANF, and that's a federal thing, that's not a county thing. But again, as a leader, I have to look at every opportunity and resource that I put on the street to ensure that I'm eliminating the barrier. I'm not the barrier for the victim, because when you do that, you increase stress and they feel overwhelmed. So.
These were just two critical points. First, Brandi, what you said about don't judge me, that's what you can do. Family and friends are really on the front lines of this issue. Even as we try to shore up our police and law enforcement response, we also know that most victims of domestic violence don't call the police, and many don't want to. And that means it's everybody's business. It's not just a law enforcement problem, it's everybody's problem. And so family and friends are really on the front line. So being non-judgmental and supportive, not to ask the why questions. We don't want to ask somebody, why did you stay with a guy like that? Or why are you still in that relationship? Or why haven't you left? Because those are completely the wrong question. The right question is, how can I be of help? And then what you said, Director Bivens, about let's remove all the barriers, that is it right there. If we could do those two things, we're a long way to solving this problem. Not judge the people that are affected by it and remove the barriers to getting help. I mean, we have to do all the other great work. Franklin County has just gotten this wonderful project called Blueprint for Safety, which works in all the systems, law enforcement system, from arrest all the way through sentencing and probation, to audit safety for victims and accountability for offenders. We have to do all of those things. They're critically important, and we're fortunate to have that project and to have the county and city leadership working together. We're a part of that project. Yeah, and yet it's these two things that everyone can do, right? You don't have to be an expert. You just have to think about this. Don't judge and make it easy to get help. That's what it takes.
If I may say one other comment, reiterate what she said about the points of a part of being the amongst your friends and families or those who know you personally for speaking directly to a victim. First off, you are a victim, but that does not give permission for the abuser to go away or get away with whatever they've done, because the focus is now on you. That's not okay. That is not okay. You don't deserve it. You don't deserve it, no matter what he has told you, no matter what she has planted in your mind or reiterated for you or on you. It's not true. Love does not hurt. Love does not lift a hand. Love does not internally mess you up. Love does not alter your feelings in a bad way. That is not love. That is not support. That is not help. That is not being on one accord with someone. Speaking to the resources, everything that Joy is speaking of is correct. The resources are out there, and everyone has done, and Joy in the departments that she's connected with have done their part. But me speaking personally, I've been on the end of, now the barriers are gone, and now you have to get to the local, when I go to local offices, it's a matter of respecting it. You have to respect it. Now that it's been put in place, respect that it's there. I am a recipient of the relocation funding, and it took a while to get there. I go in there and I'm like, you know, I have this resource and I know you have it. The funding is there and I need this help. It's here for me. I get blown off. It's there. But I get blown off. Why? Because they have so many caseloads in a day, and they don't work on Mondays and Fridays. Right. And they don't choose to do their workloads on them days. So it's like, they'll get to you when you get to. Yes, it's there, but the Family for Safety and Healing has, they are one of the only ones that took it serious and that take the resources and the funding very serious. Not to say that no, maybe the people that I've come in contact with those offices, they don't, but maybe I just had, you know, bad experiences. But the funding is there, and if you run into one person that does not embody the values or the hard work that Joy and the other people that she's connected with has put into place, don't just stop there. Yeah. Don't stop there. The funding and the resources are there. You just have to keep going.
Yeah. And can I just jump in just really quick? And thank you for sharing that and being transparent, because you know, one of the things I take very serious is, and one of our family stabilization unit specialists is here with me today, Ms. Whitney Gordon. One of the things I think she will know, and I take very serious, is hearing that type of feedback, right? I'm not gonna cover for anybody, but I would like to know when it happens, because when it does, I don't send a supervisor. I'm coming to see whoever interacted with you, because it's just that important to me. And that's why we've lifted out that whole unit and made it its own unit, so it specializes, because people need individual assistance, you know, high touch. So that's why we did that. The other thing is, you know, going back to Lynn's point, you know, we have to get back to being the village. There used to be a time when, you know, I remember growing up and I would walk down the street and someone would say, "You're such and such daughter," and, you know, ask you a bunch of questions, and you dare not get smart with them or get curt with them, right? Nowadays, we're like, well, we can't say anything, or I see something's going on with Brandi, or I see something's going on with Joy, but I don't want to be intrusive. It's time to be intrusive. It's time to get back to being the village. It's time to get back on knocking on doors saying, "Hey, how you doing? Hey, I just saw you had a baby. Brought a pie over. How's the baby? Let me hold the baby." You know, or something. Ask people how they're doing and be genuine about it, and not just allow people to say, "Oh, I'm just doing fine." Have a conversation. Look people in the eyes. We've gotten away from that. And that is why I think a lot of times people don't feel safe, because it's real surface. But when we get back to being a village and checking on each other like we're supposed to do, maybe people will feel loved and embraced like they should, and feel warm in order to open up that conversation regarding their domestic violence.
And I think, Brandi, you helped so many people when you said reach out for help. Because it's so hard for survivors. People are embarrassed, they blame themselves, think it's their own fault, and are afraid of being judged. So by telling everyone who's listening and who's here today to reach out for help, you've made a tremendous difference. At the center, we do, as Brandi described, we have a team of advocates and counselors who help somebody navigate that system and find what resources are out there for them. We also, and Franklin County has the lethality assessment project through the Columbus Police Department, and Sergeant Ketchum said that they had between January and October conducted over 1,900 lethality assessments. So this is a tool to examine what kind of danger somebody might be in, and that the majority of those were high-risk cases. So particularly if you hear from somebody that they're experiencing threats to kill, threats to harm children, attempted strangulation, sexual violence within the relationship, these are all indicators that something quite serious can happen. 4 women a day around the U.S. are killed as a result of domestic violence, and as we learned, it's going up in Ohio right now this year and in Franklin County. But those are often preventable homicides if people are listening and paying attention and getting people connected with resources. And I hear a lot from survivors who they told somebody, he said he's going to kill me, and whoever it was, the listener was, said, oh, that will never happen, or really tried to minimize it. And in fact, the reality is we know that whatever someone who's committing this kind of harm threatens to do, they're quite capable of doing. So if you have experienced any of those things, please reach out for help. You can call the Choices hotline. You can send a text to Zach Klein's Victim Advocacy Unit at the City Attorney. You just, it's hard to do it, but it can be, it can be life-saving to reach out and tell somebody and get the help that you need.
And I think also in other municipalities, even outside of Columbus, right? Because,
yes,
you know, Columbus is its own municipality, but if you're in another municipality like Reynoldsburg or Hannah, you know, I know my husband's a city attorney in Whitehall, you know, they all have domestic violent units or specialists in those communities, and I think it's a matter of knowing what resources in your municipality is so that you can make that connection as well.
Speaking on that point, I can say that my abuser was a part of the Columbus Police Force.
Yeah.
So I pick up the phone and I call the police.
Wow. And
they know him. How can I trust you when my abuser is your what do they call them? The partner, riding partner? I don't know what they call them in the car.
Yeah, the ride-alongs.
Ride-alongs.
Yes.
Yeah. How can I trust you when my abuser is the ride-along? So there is. It's not just low poverty. It's not just low poverty. It's
yes,
everybody.
Right.
Everybody,
right,
every tax bracket, everybody, everywhere. So no matter, this is one key thing that I learned with my counseling through the Center for Family Safety and Healing. They're just not that big. They're not that big. So if you reach out to municipalities and other community resources, or even to a family, and they minimize it, as Lynn said, it's obtainable. Help is obtainable. And for me, I was never a person to follow along with resources. I'm a person of, I need to be able to pick up the phone and I need to know you personally, and I need to know that, okay, Lynn and Joy, they've been a part of it, that's fine. And I never heard Lynn's testimony before. I never heard her speak on her, but it brings me closer to her, because now that I know that she's a survivor as well, and she's gone through similar situations. Now I can call her and I can say, I can feel more comfortable telling her, well, you know, I've dealt with this piece, and I can be more personable with her versus calling someone on the phone and not knowing if I'm gonna just leave a recording and then no one's gonna answer my call back.
I mean, the key relationships really are the key. And that's why I think, in Director Bivens, you were sort of talking about this need to really nurture the informal leaders in the community. So who's the person in the community that everybody talks to? Who's everybody's grandmother? Who's everybody's auntie? And nurturing that connection, and that person being equipped with information about domestic violence so they know how to connect survivors up with resources and how to get help. That's very important. Those informal community networks are just as important as anything that we might do in the center.
Tremendous. And, you know, with the recent experience of COVID and the isolation we all, you know, can feel from that, just rethinking our role in community, our responsibility to community, I think that's coming through loud and clear in what you're saying. One thing I want to revisit again, too, so individually, take action, engage with people you're in relationship with to support each other. But when it feels like more than that and you need to connect to community resources, you've named a number of potential resources. You've also named barriers where that resource may actually be a threat to you. So it's not as simple as, you know, here's a simple list of numbers. But if you were to identify the 1 or 2 or 3 places you would go first in terms of your advice to somebody seeking assistance, just very specifically, like if you didn't know where to start, where would you start?
I'm very partial. I love all the resources, all the municipalities, everyone, and everything out there. I just love everyone. However, specifically, if you need a starting point, the Center for Family Safety and Healing. I've gone to apply for assistance, or I've gone to apply for different things, and they give you this packet. You have to fill out your application for the assistance that's needed. Then at the end of it, it's like, here, this is for if you have issues, this is for if you have problems, you know, call this number, read this long, and then initial here. And so I call there, or I take the paper home, and I'm like, okay, they gave me this, and they told me that if I had any problems at home, or if I have anything that I'm worried about, call this number. I call them, no answer. I got to the Center for Family Safety and Healing through the prosecutor's office. So this was not your local Job and Family Services. This was not any other resource that was out there. This is just, you know, through the, and it struck me as interesting because going to the prosecutor's office, I just thought I would, you know, like everybody else, be another piece of paperwork. But going there, you can start 1 or 2 ways. For me, it started there, and then they gave me the resource, and they were the ones that called me, Alyssa called me immediately at that moment, and that's where it started for me.
And I think with our agency, just so for everyone to understand, again, we have 400,000, we had 350,000 people receiving public assistance before COVID. We have over 400,000 people currently right now receiving public assistance benefits. So unfortunately, our agency is not tailored for issues or work in domestic violence. But again, as a system leader, I have to carve out niches and opportunities. So now all the now what we do is, and I know, Brandi, you talk about packets, and we don't even use paper anymore. Everything we do now is online, other than that emergency assistance program. So I would start where the expert on the stage said, start with that organization. Again, but if you need emergency cash assistance or food, that's when you come to us. One of the things, again, we're doing at Job and Family Services is we're changing the way we do business. Again, Whitney is with us today. We're doing a program that we're piloting with boys of color in the juvenile justice program. When boys of color come to the juvenile justice program, or juvenile justice court, you go down there with your parent, your grandparent, you do your thing, and then you walk out. It's Whitney's job and her team's job to go in and see who all lives in the home. And we're going to high touch wrap around you, and we're going to follow you for at least a year. We're going to help set you up with every resource that is available to you, and we're going to develop relationship with you, because we believe that's what this takes, right? But again, our agency is not tailored for this type of work, but we're changing the way we do business. Because if on the document, as it states in my job description from the feds, my job is to ensure that accuracy and administration of benefits are received to the public. But understanding that we have so many issues in our community, we would be doing so many people a disservice if I stopped there.
I have to mention that as important as this issue is, it's not enough of a national priority to properly resource the work on domestic violence and sexual assault and child abuse as well. So we've just experienced a 55% cut in funding for our Child Assessment Center and our domestic violence services from the Attorney General's office. The problem stems from the federal level. It has to do with the way the federal government manages the Crime Victims Fund, which funds a lot of these services. So if we really prioritize this issue on the national level, if we provided funding to the scale of the problem, remember 1 in 3 women experience some form of abuse, and there's all the children that Director Bivens folks are going to be seeing now in the Family Stabilization Unit who've witnessed domestic violence. If we actually understood the scope of this problem, we would resource it better. And so we wouldn't be sitting here. This just happened within the last week. Victim service agencies all over Ohio have been cut, but we took a disproportionate cut for our child abuse and domestic violence services. So we're kind of scrambling to figure out what does that mean to the kind of care that we want to promise we make, I would say, to this community. So we have to, from the federal level all the way to the local level, prioritize this issue. It is so much a part of the fabric of our communities, and it's related to so many other social problems. We've got to do it.
May I also add, I don't want to minimize the resources that are out there, as Joy was speaking of. No, that is not their role. That is not getting the cash assistance and doing all of those things. That is on a more personal level or more hands-on level. That is something that I am aware of and that I have had the experience of getting assistance with. So thank you for that. And thank your community and your resources and everyone who works with you for that. It's very much helpful as well. But to hear your piece on your program that you all have launched or is coming out in your hands-on, going into the house with the children, that within itself, if you come in the home and if you're focusing on my children, and there's barriers and there's things that are also in the way, but there's also my own personal barriers. Well, I have this on my plate, I have this on my plate, I have this on my plate. But if you're coming into my home and if you're showing me that you can help me with that issue, that is what we need. We need more hands-on. We don't need lip service. We need hands and feet.
Yeah, I was going to amplify the same thought where there are an array of services available, and in that moment of crisis, for the individual to have to figure out how to package that together can be really challenging. But if you have somebody who's a point of coordination, who kind of knows how things fit together and can help you identify the services that fit your circumstance, that's a totally different model. So I wanted to applaud what the county's doing. I do want to make a quick announcement. We're going to move to questions from the audience in just a few minutes. We hope to have some live audience questions through the chat, which means we're at a point where we have kind of a final word from the panelists. I've got to say the flow of the conversation has been wonderful, and being in tune with things that really do seem to work and the barriers that need to be addressed. After kind of hearing each other, what are some final thoughts you'd share? The most important thing you would want to leave folks with?
Well, we didn't quite get to prevention, and the fact is that if we can address this immediate crisis we have in our community, there are strategies that can prevent domestic violence. There are evidence-based strategies working with young people in schools and in the community. So this is a mission of ours. This is part of our strategic plan for the coming year. I thought we'd be farther along than we are now, but because of where we are with COVID, we haven't been able to operationalize that. But there is work that can be done with young people to change social norms about violence. It's a population health approach where you really can get young people in the middle school age in particular to think about this problem differently, to develop skills to deal with conflict in their lives, and to have a positive approach towards relationships, and to change some ideas around masculinity. I mean, let's be honest. Domestic violence does happen to both men and women, and it happens to people who are non-binary as well, so it's a problem for everybody. But the reality is it's, in general, men who commit this violence. And it has to do with these notions of masculinity. and power and control and dominance. But young boys, they don't have to do all that. They can unlearn that. It's not easy because there's all these other pressures in society, but that's what we all can do, is nurture these different ideas about what it means to be a man, and that will help end violence against women.
For me, it's a matter of a couple of things. To nurture the idea, as Lynn was just speaking on, to nurture the idea of recognizing that recognizing that I do have a need, recognizing that I am in a situation that is not healthy, recognizing that I am in a situation that is subtracting and that is not adding, recognizing that as the resources that were, a lot of resources that Lynn and Joy both mentioned, I didn't have knowledge of. They're out there, but I didn't have knowledge of it. And a lot of times, the local offices, they don't, it's just a part of their job where they just add it in. As Joy said, that they do everything on the computer. I'm not gonna sit and read 8 pages. I just can't. I just can't. I'm not going to sit and read 8 pages. I'm clicking. Yes, I'm probably signing my life away and don't even know it. I'm clicking. Yes, yes, yes. I just need to get to the end. Yes, yes, yes. But it's to nurture within yourself, being an ambassador for the center, knowing that you have to know your own worth, and don't count on somebody else to teach you your worth. Don't do that. It's no one else's responsibility, because just as a person can give you something, they also can take it back. Mm-hmm. So knowing that you are worth it, and knowing that there are people and there are things out there. My attack was more so, as Lynn was stating about the physical part of it. My attacker was more I would give him the tools to use against me, so he never put his hands on me. I want to make that clear. He never put his hands on me, so abuse, it's not always about physical. It's not. I was worked on mentally. Mentally, he got in my head. Mentally, I have to work on onus. Mentally, I allowed him to work and to get inside my head. I gave him the tools that I need. He would ask me things such as, he would ask me things such as, what is it that you like, or what is it that you need? What is it that you're lacking? What do you look for in a man? And everything that I gave him, he worked that to work on his behalf, and then he ended up mentally abusing me with what I gave him. So abuse is not always physical. So I learned a lot today sitting on the panel with these wonderful people, and I enjoyed myself. And just knowing, a takeaway from today is that even though the statistics are out there, whether they be high, whether they be low, we are still one. We are still relatable, because we are in a situation that is so similar, no matter what the race, no matter what the monetary value behind it, no matter what it is about. We are still one. We are still tangible. And we are here to help you.
So when I walked in today and sat down with Brandi, I told her, I said, I'm here to learn. Remember when I said that? Yes. I'm really, when you have these types of conversations, one of the things, again, as a systems leader, you have to go back and figure out how you can tweak and be more intentional, right? So the takeaway that I have for today is, if you are a system leader, because again, my system is ginormous. It's 600 people, 400,000 cases, right? And that's not making an excuse. It was built that way, right? But if you're a system leader and someone said cell phones, if you are the system leader for cell phones, or system leader if you own a trillion cars, and you know domestic violence victims need that, donate some. Whatever decision you can make to assist someone, right? Because my system may fail someone, but someone else's system could really help them, right? So if we can piece all these systems together, and it is a clear pathway, right, to assist people, then I think we as system leaders need to come around the table and figure out what that looks like. But before we even get there, if you have resources, you don't have to wait for someone to write a grant or someone to ask you for something. Donate it now. If you have a billion houses, we know domestic violence victims many times need places to stay. Provide housing. It's real simple.
If I may add one last thing. Going into the community and then going into these places where you can get the pamphlets or you can get the information that you need, just making sure that you have individuals, in no disrespect, I say this in the most respectful way as I can to everyone in this room and everyone watching. In the community, we don't really need a lot of people with degrees or titles behind their names, letters behind their names. We don't need that. We need tangible people within the, if I go to my local Job and Family Services office, I need to see someone like me that has lived it and that can take you, that can physically take you to the place, not give you another number. I need to see people like me, me not being, of race, but in my own situation and having been, being relatable to that. So we need more people that is able to bring more, I'll say, personal awareness to it.
Well, thank you. Of course, it's the tradition here to take questions from the audience. We have a couple minutes left for the panel. Lainey Cuthbert from CMC is curating questions from the live stream audience, and we can also take a question from the audience here.
Thank you, ladies, and everyone on the panel. William Wason asks, my mother would call the sheriff after she had been beaten, but she never would file charges. What protection do we have currently for the women and children in such circumstances?
This is where I think services really come in, and it's really, when we think of the question in this way, we place the burden on the victim to take action, to take legal action against their abuser. And this is where services can be really helpful to sit and talk with her and figure out what it is that she wants to happen next. And it may be to take legal action and it may not be. So I think, and it's very hard for this person who's describing what happened with their mom and how they experienced it as a child. And it's very hard for the child in that situation because they really feel helpless. But this is when there's community services are just so important to help the victim sort of figure out for herself what are the next steps to get protection.
I agree. If I may, that is similar to my situation. I was not. They could never serve him his protection order because they couldn't find him. So it just became outdated. So it just sits there, and now I'm not protected. Just like she didn't ever file charges.
Another question.
If I speak like this, can you understand me through this? I worked in the university in the south suburbs of Chicago in the early 1970s, and we had a lot of open forums for people to come in and talk about abuse. It was spousal abuse, sexual abuse, child abuse, you name it. We were just overwhelmed with the number of people who showed up to tell their stories. It was a diverse community in all respects, and so people were coming from all walks of life. But the frequency with which this was happening was just overwhelming. The people in psychology and sociology and social work said this just blew the top off the norms. It was nothing like they had ever seen reported before. So I'm wondering, do you feel like you've got a handle on it now? Do you feel like you do have a good idea of the frequency of the different forms of abuse and things of that sort?
We know much more than we did in 30 or 40 years ago, and I should say there are some successes, and that is that the remedies that have been developed have reduced annual rates of domestic violence. So since 1994 and the passage of the Violence Against Women Act, shelters, protection orders, community education, professional training, annual rates of domestic violence have dropped by 60% or more. So it's not an all bad news story. Those things work. But what we haven't done is created the deeper level cultural change that would prevent violence from happening. So our data on lifetime prevalence is still the same as it was then, which is 1 in 3 women will experience some form of abuse in their lifetime. But annual rates of domestic violence have dropped. So the numbers of times somebody is pushed, hit, kicked, shoved, or the kind of coercive control that Brandi described that's not physical but that is still so harmful. We know that we can intervene in those situations. We are not properly resourcing it. As I described the funding cuts, we're not prioritizing it in the way that we need to, but it's not that we don't know what works. We know what works, and we have had some successes.
Let's end there on at least a little bit of positive news. I heard lots of things: don't judge, remove barriers, time to get back to being a village, and that we're all learning. I think everyone who comes to the Metropolitan Club or listens to our forums, we all expect to learn something, and I certainly did today, so thank you. Next week, we are going to defer Wednesday to focus on a Friday, October 16, live stream only forum, where we'll be welcoming Congressman Steve Stivers and Challenger Joel Newby for the CMC's 15th Congressional District Conversation, moderated by Mike Thompson of WSU Public Media. So visit columbusmetroclub.org to check out that program and other upcoming programs, or to join or to donate. Let's thank today's presenting sponsors: Nationwide Children's Hospital and OSU Wexner Medical Center, our live stream partners, PNC and the Columbus Dispatch, and our online visual seat patrons. Thank you all. And a very special thanks to our speakers. We really appreciate the stories and information you shared today. Lynn Rosenthal, Joy Bivens, Brandi, and Greg Moody. Thank you very much for being with us. We look forward to seeing you again. And in the meantime, be safe and stay well. Thank you.